Croesawu pawb I briefio eno. Welcome everyone to tonight's briefing. Now, before we begin, I'd like to provide a brief technical introduction. We're using Microsoft Teams today, and this means that not only can you watch the meeting, but you can also take part. On your screen, you should see a tab with a question mark on it, and this will normally be in the top right of your screen. If you click on this, it gives you the opportunity to ask questions. Now, please accept our apologies that we may not be able to answer all of the questions during today's meeting, but we will continue to update our website with all the latest information about progress and opportunities in the Health Board and specifically about COVID-19. Microsoft Teams also offers you the opportunity to see live subtitles of today's proceedings. You should see a button in your settings to switch on subtitles. Subtitles for today's meeting are available in Cymraeg and English, as well as Arabic, Polish, Bulgarian, Slovak and Urdu. Today's meeting is also being recorded. Now don't worry, this doesn't share information about you in the audience. Just the information you see broadcast on the screen today will be visible. So this means that people who aren't able to join us live this evening will still be able to watch today's briefing. Now thank you for joining, and our briefing with Hayley Thomas, our Deputy Chief Executive, will now begin.
Diolch, Adrian. Noswaith dda I chi gyd. Good evening all. Yes, this evening we're going to provide an update on where we are against the COVID vaccination programme in Powys. And I'd like to start, if that's okay, by reminding us on the journey and context that we're currently working within. So on the 14th of September, we had a position where the boosters for the people over 50, our frontline health and care workers and people aged 16 plus with underlying health conditions, adult carers and adult household contacts of people with severe immunosuppression were provided with a minimum 6-month interval after the primary course. And then it moved on the 15th of November that we had to adapt as a programme to ensure that boosters were extended to all 40 to 49-year-olds.
Annie Bullman.
Apologies. I should have turned my phone off. Apologies. But that boosters were extended to all 40 to 49-year-olds with a minimum 6-month interval after the primary course, and also the decision to extend second doses to 16 to 17-year-olds. This in reality meant there were additional 15,000 vaccine doses that we had to deliver through the Powys programme. On the 29th of November, we then had updated guidance to say that the boosters were extended to everyone aged 18 and over, and that the interval between the primary dose course and boosters was shifting and reducing to 3 months. This national offer was for all eligible adults to have this by the end of January, and second doses were extended also to the 12 to 15-year-olds. And again, that would mean an additional 28,000 vaccine doses and faster delivery. But as we're all aware, in response to the very serious situation regarding the Omicron variant, and the decision taken by both the Prime Minister on Sunday and also our First Minister in Wales last night, we now have a new requirement to ensure that basically the eligible population are offered a booster by the end of December. And for us, that means an even faster delivery programme. With regard to the variant, just thought I'd mention a couple of things. So we know that the evidence base is becoming clearer, and we have more information around the position now, and we're finding that the doubling rate for the Omicron variant is now at 2 days, and they're expecting that by Christmas that the Omicron variant will be the dominant variant in the UK. So the best protection that we can offer ourselves and our families and friends is to ensure that we have the booster, because that will give us the best level of protection in this context. On the next slide, this demonstrates to us where we are now as of yesterday in terms of delivering the booster programme in Powys. So we've already delivered around 56% of all adults have received their second dose, have already had their booster. So this represents around half of all adults. And although this is really good performance, and we're really proud of the team's delivery in Powys, what this really means for us is that we are now having to deliver over the next 2.5 weeks, by the 31st of December, 42,000 doses. So this is around double the level of activity, a bit more than double actually, of what we had planned to deliver during this same time based on the guidance on the 29th of November. So we'd already put in train that all of the eligible population were having letters, and those letters had already been sent through the system to go out to offer appointments to our population by the end of January. So please accept our apologies. Some of you will be having letters now offering you an appointment after the 31st of December, but this was already in train before the decision that was taken on Sunday night, and they'll be landing on the doorsteps over the next few days. And the key issue here is that if you have an appointment before the 31st of December, please come along to that. But also there will be other opportunities, which we'll take you through in a minute, to drop in for those who might receive a letter with an appointment after the 1st of January. So where we are now, again, just a little bit of information here, is that, again, a strong position. We've got over 90% conversion from primary course to booster for the older age cohorts, which you can see here. And also that we've put in place already to encourage an increased uptake for care home workers, the availability for any care home workers to come along to any site to come forward for their vaccination on a drop-in basis. But as you can see here, we're making good progress, but we've still got a long way to go to deliver against the target now of the 31st of December. So what we're currently doing in response to this, and before I sort of go into the detail, I just wanted to say that this is a huge ask for the workforce of Powys, not just for the Health Board, but for all of our partners, including the local authority. Powys County Council are working alongside us, as well as PAVO, in organising the volunteer efforts that goes behind all of the programme that we've got in place in Powys. So the teamwork, the dedication and commitment, and the very can-do attitude that the teams and staff members have shown over the last 48 hours in response to the latest announcement is exemplary and is a huge credit to the community of Powys. So we've been working really hard. So we have been doing quite a lot of planning work, still not quite sorted, but we are getting confident now that we will be able to put a plan in place. But we're working to identify the workforce in order to fill the additional capacity that we need. So first of all, we'll be ensuring that the drop-in offer is very clearly publicised, so that at the moment it's currently based on age. So the older age cohorts are being invited to come in on a drop-in basis, and as we proceed over the next few days, that age will lower. We've maximised the number of lanes that we've got across our mass vaccination sites. We've currently got 3, one in Brontlees, one in Bilth and one in Newtown. And also we are currently this week, we've got a pop-in, sort of a pop-up clinic in Ystrad and Lais, where we've been able to extend that clinic for the rest of the week in order to encourage take-up in that area. The other issue is the additional opening days. So our original plan didn't mean we were open every day between now and the 31st of December, but we are having to revisit that, and we will now only be closed on Christmas Day, Boxing Day and New Year's Day. And we're currently trying to identify the staff in order to open all the clinics across all the sites over the rest of the remaining days. We're also looking at identifying the staff to extend the opening hours. So again, going into the early and late evening so that we maximise the opportunity for people to come forward for their boosters. So we're really in the thick of the planning of this at the moment. And as we get firmer plans and we've got the rotas filled for the staffing to deliver this, we'll be making sure that that's publicised and you'll receive that information. But the success of this programme is down to our population's response to the offer, and we really need your help to do this. So if you have received an appointment letter, the next slide sets out what we'd like you to do. We'd really appreciate if you could attend at the time we've offered you. Unfortunately, we're getting a lot of calls at the moment to reorganise appointments, and we are concerned that we might find it difficult to give people the choice that they've been familiar with previous to this point, in terms of being able to offer the appointment to completely suit around availability. So really would appreciate if people could take up the appointments at the time that they're given. If you, as I've mentioned before, receive an appointment letter past the 1st of January, please check out our latest drop-ins and we will encourage you to come forward earlier. We haven't got the time to resend appointment letters out between now and Christmas, so we'll be managing it in that way. And also, we've got to apologise. This is a public health emergency and it's about getting as many people vaccinated as quickly as we possibly can. So we're really proud of the vaccination programme in Powys and the experience that people have when they come to our centres. But with the increased throughput that we're having to manage, we're really asking for people's patience. There will be longer queues for people dropping in. And we're really working hard at the moment to make sure we're able to separate those queuing for appointments and those attending for a drop-in. I'd also ask you to please, this winter, come along being ready to have to wait for a period of time, but also to make sure that you do let the volunteers know if you've got particular needs where that would be difficult for you. We will try to accommodate your specific needs if you're unable to wait in a queue as you're entering into our vaccination centres. And also we have also had pods in place for the vaccination centres in order to maximise the number of people through. We will find now that most of the pod spaces will be less. So if you're needing privacy, please let the staff know and we'll ensure that that is managed. But most people will be in an open plan area when they receive their vaccination. And then the final thing I'd like to pick up on is that this is really the whole of Team Powys coming together, so the County Council, PAVO and ourselves, to deliver this programme. And we would really appreciate if you have got a few hours of spare time available, that you would identify yourselves and let PAVO know, because we're really also needing to identify a large number of volunteers to help us manage health and safety and wayfinding on the sites, particularly with the large numbers that we need to get vaccinated. And I do appreciate this is the Christmas period, so it is a big ask for people to come forward for their vaccination, but also for our staff and for volunteers. But I really would implore you all, the best present you could give yourself for Christmas is a booster, and I would really ask if you can prioritise to come along, that would be great. So that's me, Adrian. That's a quick summary from my perspective. Shall I hand back to you?
Thank you very much, Hayley, and I'd certainly echo the comments you've made about the staff involved in the vaccination programme and all of the support from the volunteers and the wider communities. This has certainly been a very big ask on them, and it's a very big ask on the people of Powys as well, in order to find the right way to take up the offer of COVID vaccination before the end of December. And the teams are certainly doing all that they possibly can in order to increase the capacity within the programme in order to deliver that offer. Now, COVID is just one feature, but it's really clear, isn't it, that we're facing another challenging winter. There's already a lot of pressure on health and care services and pressure on all of our lives as well. And COVID-19 continues to have a very significant impact itself. Health and care services, we are here to help, but this Christmas and New Year we're going to see 2 extended bank holiday weekends, which means that many high street services will be closed over those extended weekends. And so, as always, we really do need everybody's help this winter. And there's a wide range of things that we can all do to protect our own health and well-being. For example, just making sure we have a well-stocked medicines cabinet and the right supplies of our repeat medications. And on the next slides, we've got a few more top tips for ways in which we can look after ourselves this winter. Okay, so next slide, please. I think one really important thing for everybody is to keep moving, and I think it can be easy as we get into colder weather, and particularly when we're concerned about COVID cases and the new variant as well. But finding that way to take advantage of the open spaces that we have here in Powys, or even keeping moving within our own homes. Just a little bit of activity can help all of us to keep our strength and mobility, and building in all kinds of simple exercises into our daily routine to help us keep moving. I think for many people as well in this current day and age, they may well be working from home, they may well have a desk and be less mobile than they previously were. So building in those habits into the day for a little bit of exercise, a little bit of moving around are particularly important, and even more so at this time of year. Now, clearly, we might face times when it's icy or snowy outside, so it's really, really important to keep safe. And having the right footwear for the right circumstances is important too. We do know within the health service that one cause of falls, for instance, can be the type of footwear that people wear, including the types of slippers. So I know you'll often see on social media posts from the health service about the right type of footwear to wear to keep us mobile and keep us safe. Okay, next slide, please. Eating well is really important too, and I know that can feel a bit tough at Christmas when there's lots of nice treats around. If you go onto the Health Board website, you'll find a news story with recent top tips from our dietetics team about ways to eat healthy and just find the right balance between all of those foods and alcohol that are on offer, and keeping a right balance of food within our diet. So preparing meals and making sure we eat a healthy, varied diet, it can be hard, but it's really important, and even more so at this time of year, to make sure that we get the right nutrients to keep us healthy during the winter months. There are some useful menu ideas and recipe ideas on our website as well for ways in which we can keep healthy and well during the winter. Okay, next slide, please. Keeping your home warm, and I realise as well as fuel prices rise, this can be a challenge. It's important to try and heat your home to a steady and comfortable temperature throughout the day, particularly if you are at home. And if you are facing issues such as fuel poverty, then looking out for the range of support that's available to you in order to give you the support that you need to keep your home warm during the winter months. Many parts of Powys are quite a distance away from the main towns. We might be reliant on domestic fuel oil or other sources of heat in order to keep our homes warm. Planning ahead to make sure that we've got enough oil in our tanks before snow or bad weather comes can be a really important issue. So checking your fuel levels in your tank is a job definitely before we go into the winter. I think a next key area for all of us, we've talked a lot about COVID vaccination, but flu vaccination is really important. Last winter, because people had been circulating less, then we didn't have as much flu circulating within our communities as we had in previous years. But I think this year we'll have more contact with each other. We may well see cases of flu rise as well. But free flu immunisation is available from GP practices and from high street pharmacies for people who are eligible for that free NHS flu immunisation. Flu can make us seriously unwell, and particularly as we get older, so the best way to protect ourselves is with the flu jab. And obviously at times we will need to go outside as well. Wrapping yourself up warm is really important, and Hayley's already highlighted this in relation to the fact that we will see some queuing at our mass vaccination centres as we try and ramp up the activity. So layering our clothing is a really good way to keep warm if we're heading out. And as I mentioned earlier, choice of footwear can be really important too. And if you are heading to the mass vaccination centre, thinking about layers, but also when you've taken those layers off, how can you maintain your dignity, but also let us have access to your upper arm so that we can reach your upper arm to give you your COVID vaccination is a really important factor as well. And I think another top tip really at this time of year and always is to stay connected. I know from talking to a lot of people that COVID has made people feel more isolated. It has clearly had a really big impact on people's mental health. So trying to find the ways to keep in touch with people that we care about can make an enormous difference to how we feel. And if you know of vulnerable or isolated people in your communities, thinking about ways that you can reach out and make sure that they don't feel lonely this Christmas and throughout the winter months can be particularly important. Whether that's meeting up in person, making sure that we're applying social distance, or catching up on the phone, or using all of the latest digital technologies to stay in touch. There's lots of great ways to make sure that people don't feel alone at this time. So those are just some useful top tips that we can share this winter. I'm sure you'll have your own as well, so you can use the messaging and the question bar to raise those yourselves. But that finishes the briefing that we were planning to have tonight, and now it's a chance to answer any of your questions. So Hayley, I think the first question that we've had, you've touched on this a bit in your presentation, but we have seen long queues at our vaccination centres this week. And I think the question is, what are we planning to do about those queues as we go forward?
Yeah, so at the moment, we're inviting people by age. But we're still having a large number of people turning up, and it's very difficult. People tend to come at once. So we've got to keep it safe. So we're in discussions about car parking and access and how we manage flow safely into our sites, but also on a very simple level, it's about queue management. And the team are working very hard. And we've got some teething problems that we're working through on it to ensure that there are two separate queues in place. One for those with appointments, because people may have organised their work commitments or family commitments around an appointment, and those that are coming for the drop-in. I would just ask for patience. We are taking a bit of a review today because when we opened up for the drop-ins earlier this week, the level of demand. So we're taking a bit of a breather tomorrow for two of our key sites, just to double check that we've got all of the operational arrangements in place to maximise the throughput and to avoid delays. But in Lister tomorrow there is a drop-in clinic. But generally, I just prepare people for a bit of patience. We will get you through as quickly as we can, but we've got to do it safely. I don't know if you wanted to add anything, Adrian, but you know, from my perspective, it's just come prepared to have a little bit of a wait at this stage.
Yeah, and I think interestingly enough, whilst we've been speaking here tonight, I've just had some information through from our centre in Newtown. Newtown's been incredibly busy. Bilthwells has been incredibly busy as well. Today, our initial plan was that we would vaccinate around 700 people in Newtown before we closed. Already through the doors, we've vaccinated over 1,000 people in Newtown today. That's 300 more than originally we had planned to do. That's 300 more than 300 more people that now have that important booster protection before we go into Christmas. So thank you so much to the people who've attended. Thank you to the teams, and thank you for everybody's patience. As Hayley said, we'll have a little bit of a pause on drop-ins for tomorrow other than in Ystrad Gynllais, but do keep checking our social media channels for more opportunities coming up over the next few days. And I think on that issue of Ystrad Gynllais, Originally, the clinic there was due to be an appointment clinic on just Monday and Tuesday. So you touched on there that now looks set to open for a few more days. Is that right?
It is, yes. So first of all, huge thanks to the Miners Welfare Hall who accommodated us, despite the fact that that's meant a huge amount of rework for them in cancelling some events that they had planned in the hall. But yes, we're planning to stay there until Friday, and those appointments, there are no appointments for the Wednesday, Thursday and Friday. It will be running on a drop-in basis. So again, when you come along, a little bit of patience for that as well. But huge thanks to the Miners Welfare Hall for letting us stay on.
They've done an amazing job, haven't they? And the whole team there and the support has been incredible. And as you said, I think if we're able to keep that open for the rest of the week, then day by day the age eligibility will go down, so that the aim is that by the end of the week we'll be able to offer a drop in there for 18+ to offer vaccination locally to as many people as possible.
Yeah.
Next question actually is around vaccination for under 18s, and I can potentially answer this one if that's okay. But people are asking just for clarification about the time interval, because that has changed, and I know that has caused an element of frustration as well. So originally the time interval, for instance, after COVID infection for under 18s was wait 4 weeks after COVID infection. Now that has changed now to 12 weeks, 84 days. And so that did mean, for instance, that some people who originally thought, well, I can't come now because my child's just had COVID, I'll bring them back in a month's time. When they came back in a month's time, they found that the guidance had changed, and the guidance had changed for good clinical reasons, but clearly that did frustrate some people. We apologise for that. It's outside of our control and national guidance, and we do always follow the national guidance in relation to the delivery of the programme here in Powys. In Hayley's earlier presentation, she talked about eligibility changed earlier in November to offer second doses to 16 to 17-year-olds. Now, we've already been able to send invitations to around half of the 16 to 17-year-olds, and the remainder should have their letter very soon if they haven't received it already, for appointments that are taking place this month, because that will be at least 12 weeks after their first dose. Many of those first doses were taking place in August and early September. So the guidance for under 18s at the moment is that we offer a minimum 12-week interval from first dose to second dose. And then that applies to the 12 to 15-year-olds as well. So many people who came in as 12 to 15-year-olds for their first dose came through in October. And so the appointments are just being arranged for that age group to come back from early January for their second doses with that 12-week interval. But please do remember that it's also a minimum of 12 weeks since confirmed COVID infection. So if you've had a COVID infection more recently than that and you're 12 to 17, please do contact us to cancel and rearrange, as we will need to offer you that appointment at a later date. In relation to the programme as well, next question is asking about, well, do people who had severe immunosuppression at the time of their first or second dose, they've been invited back for a third dose, do they also get invited back for a booster?
Yes, basically, yes. So they will come through then for a booster after they've had their third dose. So we've made really good progress in offering those third doses for that category as well.
Right, and if you're in that category and not sure if you should have had been invited for a booster, remember the booster should be 3 months after your third primary dose. So if you've already been back for an appointment this autumn for what you might originally have thought was for your booster, you may then get a further invitation if you're in this eligibility category to come back again for what will be your booster, and that will be at a 3-month interval. And I think if you're one of those very first people to come for a booster in the late September, then that means that actually the dose that becomes your booster will be late December or early January. So whilst the national ambition that we described is to offer every eligible individual a booster by the end of December, that will only include those people who've already passed that 3-month interval. So if you're not yet due, then your appointment is still to come. Now, the booster programme is a lot of work, isn't it? And particularly accelerating. And you talked earlier about staffing. I think what do you think might be the impacts on other services right now in relation to ramping up the booster programme? And more generally, how are services faring during the winter?
Yeah, well, it's a very fine balance, because the pressure currently, particularly in the unscheduled care system, is immense. So the level of escalation that we're seeing across our neighbouring district general hospitals and A&E departments is significant, and we're working very hard in relation to making sure that as a health board, because our patients go for that acute care outside of the county, that we're focused really hard about bringing our patients back into Powys and making sure that we're helping stemming demand in the first place from being sent into the acute sector. And part of that is working very, very closely with primary care. They're extremely busy as well, and we're wanting to make sure that the primary care offer is sound and available during this period of time as well, because we know that's a really important part of what we provide in Powys. I think the broader impact here is that we will need to be redirecting staff to fast track the acceleration of the vaccination programme, and we've actually got meetings today, tomorrow, to identify the level of gap we've currently got in filling those shifts. And that might mean that we will have to take some quite difficult decisions around redirecting resources to cover this work. Now, we know that the work that we do on system resilience, our community hospitals, our inpatient wards, and supporting urgent and emergency care has got to be protected. But there will be other aspects of services that we may need to at least, not perhaps close, but reprioritise during the next 3 weeks in order to get to a place where we've got sufficient staff to run these rotas. So there is a board meeting discussion tomorrow, Adrian, afternoon, to confirm the decision around that, but I'm expecting we'll be able to communicate that not just to the patients that might be affected, but also we will be in discussions with the CHC, our Community Health Council, about any impact on services that will happen as a result of accelerating the vaccination programme. But to be frank, we're going to have to reprioritise during this period. So there will be an impact, but we will try our best to minimise that during this period. So we're currently asking staff whether they're willing to work overtime. And that's the first part of the process. We're also asking for support from services that aren't direct frontline services. So we know we've got staff that we could redirect that wouldn't potentially have an impact on direct patient care, and we're going there first. And then finally, we'll discuss those areas which might have an impact. So unfortunately, there will be an impact of the next 3 weeks because we can't do everything and we've got to reprioritise during this time. But it is only for 3 weeks and that's the only thing I can say. It'll be a hard push, but actually as soon as we get back in January, on the 1st of January, at least we'll know it's a very short period of time that will have an impact on other services.
Thank you. Those figures that you shared earlier about the scale of increase in the vaccination programme that's needed are stark, aren't they? And those can only be achieved because people are vaccinating and because of all of the other support around it. And thinking about support as well, one of the questions that we've had in is just to ask, well, how can we volunteer? So the organisation that's been supporting us with the volunteer programme is PAVO, Powys Association of Voluntary Organisations. You can find out more about them online, or their telephone number for vaccination volunteering is 01597 822 191. That's 01597 822 191. And I think amidst all of the in the news that we've shared today about the ramp up of the vaccination programme and the news that's come in the last couple of days, potentially one thing to reflect on is that last week was our first anniversary, which is quite astonishing to believe that it's a year ago that our vaccination programme started. The first clinic in Broncleys Hospital on the 8th of December 2020, and since then well over 250,000 doses have been administered through the vaccination programme in Powys. And that is a phenomenal number. That's been possible because of all of those people who've come forward as immunisers, all of the admin and support staff at the centres. It's been possible because of the army of people behind the scenes who have helped make the programme happen. The team of volunteers have been absolutely stunning. I think the venues that have supported us, Freedom Leisure for the Newtown Leisure Centre, you've mentioned the Miners Welfare Hall for our pop-up today. We had a pop-up earlier in the year at the Cow Shack in Welshpool as well, and the Royal Welsh Agricultural Society, where we recently temporarily closed for the winter fair and then have reopened with a bigger centre and more lanes in operation. The partnership from the County Council, we've had immunisers in from the fire service, the widespread support from local businesses. All of those have been amazing, haven't they? I just don't know whether there's anything you'd like to say about that team effort over the last year, Hayley.
Oh, I don't know where to start, Adrian. I'm just incredibly proud. People have gone way and above what they should have to do, to be honest, to support the delivery of this programme. And I think that we should all be really proud of everyone's contribution. That's really important. Yeah.
Thanks very much, Hayley. Now, I think one question that interests people is we've seen different vaccine types during the vaccine programme. What's the vaccine type that we're using for the booster programme here in Powys?
Pfizer is the one that we're using in Powys currently. There will be parts of Wales that are also using Moderna during the booster programme as well, but for us in Powys currently, we are currently using Pfizer.
Thanks for that update. And I guess that's because that's what the clinical evidence is telling us, isn't it, about the effectiveness of the different vaccine types in order to give us the further protection that we need. So that means, for instance, that somebody who had AstraZeneca for their first and second dose, they will be offered Pfizer for their third dose here in Powys, and indeed across the country they'd be offered Pfizer or Moderna as their booster dose. There are very rare circumstances in which somebody might be offered AstraZeneca, and that's, for instance, because they have a known allergy to the ingredients of Pfizer. But otherwise, that means that we're not offering a personal choice of vaccine. We're offering the ones that are clinically recommended by all of the national guidance, including the JCVI. So we're hearing changes to national guidance week by week as more concern about the Omicron variant rises. The First Minister has been talking about flow before you go. And so that's about using lateral flow devices. Got some here myself, got some of my kits here in order to be able to keep myself tested as well. I know there's been some challenges in accessing those through some of the national websites recently because there's been a lot of demand. But one of the questions that we've had is where people can get their lateral flow tests. And again, I guess I'm happy to answer that because it's one of the areas I've got the details at my fingertips. You can find lots of information on our website about where to get lateral flow tests. So if you go to pthb.nhs.wales, that's pthb.nhs.wales, and then you can click on testing. You'll find a big button that says testing right at the top of that web page. And then if you click on testing for people without symptoms, it tells you about the different ways to pick up lateral flow devices. Now this week you might find some members of the team out and about across Powys. We've got members of our contact tracing team from Powys County Council in supermarkets with an LFD roadshow, sharing devices and explaining how to use them. And remember, with lateral flow devices as well, there are different types. So it's really important to look at the specific instructions for the test that you're using. Some, for instance, might be just nose, others might be nose and throat. So check the specific instructions of the kit that you're using to make sure that you're following the right instructions for that type. So we've got those roadshows taking place. We've got collection points in many of the county's libraries. We also have collection points from many of the high street pharmacies in the county as well. And there's a link on our website to where you can order them online. And it's important to remember that lateral flow devices are if you don't have symptoms. That's a regular test, a regular safeguard, just to try and check if you might have the virus, but you haven't noticed. And the flow before you go guidance is if you're going out for a party, if you're going out for a gathering, those kind of things, take a lateral flow test and then check the symptoms. And if it is positive, then it's really important, if it is positive, to book in for a PCR test. And so that's another type of test that you can book online, where you need to visit one of our testing centres across the county. And it's the PCR test that you also need to take if you do have symptoms. So those PCR tests are either if you've had a positive lateral flow device test, or if you've got coronavirus symptoms, or also if you've been referred to a PCR testing centre, for instance, by a clinician or by the contact tracing service. And whether your lateral flow test result is positive or negative, it's really important to log that result online, or even if it's inconclusive as well. Make sure that that result is logged, so that we've got all of that record, and that really helps us with things like the epidemiology and tracking infections across the county as well, because that's a really, really important weapon in our armoury against coronavirus, and help us move back as quickly as possible to the levels of safety that we're all pining for after nearly 2 years with coronavirus. So I think that's the last of the questions we've had in from the public today. Obviously, we'll have further public online briefings next year. We haven't yet confirmed the dates of those, so please do look out for them through our channels. But I think, Hayley, this is now an opportunity for you to make any final comments that you'd like to make before we close tonight.
Thank you, Adrian. I think just a couple of things just to pick up on. I think that it's been really helpful to go through the flow before you go discussions, because, you know, the things that we can do ourselves during this period of time is just reinforcing again hands, face, space, the social distancing, and also the requirement now for us all to work from home if we can. There's quite a lot of things that we need to consider during this period. But no, I didn't really want to add anything much, really, Adrian, just to sort of say that the best Christmas present we can all give ourselves, our family and the community, is to come along for your booster vaccination. And I really hope that you all manage to have a very peaceful and safe Christmas. And I think we're all looking forward to a new year. So thanks very much, Adrian.
Thank you and good night.